Another difficulty that has arisen during the coronavirus is that patients have not been able to take their children to the pediatrician for well-child visits as often as recommended. This led to a decline in the number of vaccinations administered to protect against diseases such as chickenpox, measles, whooping cough, and polio. We're starting to catch up on these numbers, but there's still some reason to be concerned. There's a danger that these diseases could easily spread if children are not vaccinated. We've seen during this pandemic just how important vaccines can be. While we do not have a vaccine for COVID-19, we can prevent more than a dozen other diseases from harming our children and our communities, and we can do that right now. I want to share this public service announcement, which you will see more in the coming months. It stresses the importance of childhood vaccines in the care of our children.
This boo-boo tells a story. It's a tale of perseverance, ingenuity, and love. This boo-boo is hundreds of years of science and technology. It's protection in the battle against disease and illness. And while we continue to fight COVID-19, childhood vaccinations are more important than ever. This boo-boo, it's love in its purest form.
In addition, in the coming days, the Ohio Department of Medicaid will launch a number of initiatives to encourage childhood immunizations among their members. These efforts will be aimed at increasing safe, convenient access to vaccinations for members by providing mobile vaccination clinics and reducing administrative barriers for providers. It's critical that Ohioans and providers remain vigilant about keeping children up to date on these vaccines. We cannot let COVID-19 prevent us from meeting our essential health care needs. Please contact your pediatrician or your health department today to schedule these important well-child visits. Today I've asked Dr. Chris Peltier, a doctor from Cincinnati Children's Medical Center, to join us to tell us more about the importance of childhood vaccines. Doctor is also a provider at Pediatric Associates of Mount Carmel and president-elect of the Ohio chapter of the American Academy of Pediatrics. Doctor, thank you very much for joining us.
Thanks for having me again, Governor.
Tell us a little bit about just in general what's going on with childhood vaccinations. I know that some doctors have expressed some concerns about maybe not having enough families come in yet, and maybe tell us a little bit about what you're seeing, but also just tell us the basics. Tell us why is this very important?
Definitely, I'd be glad to. So as a result of the pandemic, as you mentioned, vaccine rates are definitely plummeting, not only here in Ohio, but across the country. We know that during the shutdown last spring, well-child visits to pediatricians fell, which ultimately, in addition to many other things like not being able to do vision and hearing screens, ultimately dropped the rates of vaccinations. Many families were obviously worried about going to their pediatrician or their family doctor. Was it safe? And we know, I want to share with you some data. So from January through April, the CDC reported a cumulative decrease in 2.5 million doses of vaccines that were administered. And just looking at the measles, mumps, rubella vaccine, the CDC noted a national decrease in over 350,000 visits. There's a national group of independent pediatricians that it really involves about 1,000 pediatricians that share the same electronic health record. And some data from that company showed that decreases in the diphtheria, tetanus, and whooping cough vaccine dropped almost 50% up through April. And the HPV or human papillomavirus vaccine rates dropped by almost 75%. As you said, it definitely is improving, and we are seeing well visits return to higher levels than they were during the spring, but in many practices, that's still not up to 100% or where it's been. And not only that, but now we're having to try to get in families that delayed their well-child visits and their vaccinations when Ohio was shut down.
So why is it important? I mean, I think we all know just intuitively this is important, but what are the consequences if our numbers are not where they need to be and if we don't hit a certain level of children with these vaccinations?
Right. So the ultimate outcome is that we run the risk of an outbreak of vaccine preventable illnesses like whooping cough, like measles, and a worsening flu epidemic than we normally would have. You may have seen the American Academy of Pediatrics has an infographic that they've been publishing on social media trying to prevent what they call a twindemic. So, you very sadly demonstrated where we're at in the fight against COVID. We are at the very beginning of influenza season. And, we worry that if we aren't vaccinating against things like measles, whooping cough, influenza, we're going to see greater closures in schools. We're going to have more impact on the economic outcomes for parents and caregivers. And I think most importantly, there's going to be a strain on the already taxed health system due to COVID to care for these children. There's an interesting study that was published recently in the European journal Lancet that really looked at trying to put in perspective. And what the data that they found showed that for parents that are worried about bringing their children to their pediatrician for risk of getting COVID, for every one death that could be attributed to COVID that could potentially be caught by going to your healthcare provider in delaying vaccinations, 84 deaths in children could be prevented from other vaccine preventable illnesses like whooping cough, measles, and flu. Now, of course, we're not, one death is too many, but it just sort of puts it in perspective when we're saying, if a parent doesn't want to bring their child to the pediatrician for fear they may get exposed to COVID, that one possible prevention of a death could result in 84 other preventable deaths due to other illnesses. Failure to vaccinate against these diseases leaves our Ohio children unnecessarily vulnerable. And with COVID-19 transmissions running high, as you so eloquently stated at the beginning of this press conference, it's more important to vaccinate kids against all preventable vaccine illnesses, but also influenza. And the American Academy of Pediatrics recommends that everybody aged 6 months and up should be vaccinated against influenza, ideally by Halloween. We have the Ohio AAP has a social media campaign right now, no boo without flu. So trying to get your flu vaccine by Halloween.
And the whooping cough is not something that we think exists anymore, but it does, right? We've had, occasionally there's an outbreak that you'll see somewhere in the country, and sometimes maybe even in Ohio, I think. So
we see outbreaks every year. It's probably the most common vaccine preventable illness that we see every year. We have outbreaks in our local schools.
And the significance of whooping cough is what? Tell us about it.
So, it in older children, it can cause what's known as the 100-day cough. So kids can have sort of this nagging cough. They may feel sick. The biggest thing is they're contagious, so they have to be isolated during their contagious period. The real risk is in young infants and babies, and that whooping cough can cause young infants to stop breathing, and ultimately we see deaths every year from whooping cough in young infants.
Wow. And pretty much preventable, right?
Exactly.
Doctor, thank you for joining us.
You're welcome.
Last question. If anybody's watching this and they have a child, who can they contact if they don't have a doctor? What do they do?
Well, so I'm going to just, before I answer that question, I will say for those families that do have a pediatrician, ask your pediatrician, make sure you're up to date. When you don't just say vaccines for well visits. If you're coming in for an ill visit, ask your pediatrician, am I up to date on my vaccines? Can I get a flu shot today? Pediatricians' offices are safe. They're open. We have flu vaccine and we have all of the other vaccines that children need. If you don't have a primary care provider, I would recommend families go to their local health department. They can go to the health department and get vaccines. Vaccines at both your pediatricians as well as your local health department are completely free of charge. And Ohio has a vaccine registry program that my office participates in, all of the county health departments participate in. And even if you don't have a copy of your child's shot record and you don't know which vaccines your child may be due for, your pediatrician or the county health department can go into that impact vaccine registry and see what vaccines your child is due for.
Doctor, thanks for joining us again.
Thank you very much.